Paso, and I'm from Newport Beach, California. I would like to share with you how I came to the decision to come to Germany and have back surgery done by Dr. Bertagnoli. I've always been very active. Golf, skied, heli ski, scuba dive, trainer twice a week. And about a couple years ago, my back started pinching. A year and a half ago, I went and had MRIs and x-rays done because I could hardly get out of bed, and I was diagnosed with scoliosis and spondylolisthesis, L4 over L5. And I, at that time, was going to a back surgeon, and our game plan was to work around it to avoid surgery at any cost, because one fusion would lead to another. Over the year, I tried everything from Pilates with a special therapist twice a week, deep tissue, soft tissue, realignment, massages, ice, and then as time went on, I added epidurals and Vicodin to the formula. And I felt that everything was slowly getting worse, and I was working harder, and it just wasn't working. I went to other doctors, and the only thing they talked about was fusion, and that to me, it didn't seem like the complete answer, because it would leave my area where the scoliosis was very vulnerable, and I felt like I'd be going in for another fusion. It was through a gentleman friend of mine in Newport that I learned about Dr. Bertagnoli, and I'm thankful for him because he kept on me until I finally went online and started reading about him. The more I read, the more I liked. I saw him doing things that doctors in the United States would not do, could not do, and didn't have some of the parts to do it. So I did research for a couple months. I talked to Tim Vickner, who I'm eternally thankful for all the hours he spent with me. And I finally came to the conclusion that I felt like I needed surgery, or I was going to do permanent nerve damage and get a permanent rotation. My world was already getting smaller because I found the only relief was to do nothing but lay down, so I was laying down more and more. I contacted Prof. We went through the paperwork, and I set up a surgery date, and they really were helpful all the way through. I've never really been to Germany. I don't speak German, so I had apprehensions, but I'll tell you, they really make it easy for you and hold your hand the whole way. The things that convinced me to come over here to Germany, where I am now, I'm recuperating, I had my surgery 3 weeks ago, was that A, Dr. Bertagnoli had an engineering background, which I think is tremendously helpful. B, he has a thirst for knowledge, and I think his teaching to other surgeons and continually learning keeps him on the cutting edge of medicine. Also, I think he has a true passion for helping people, and I saw this come through. I think that when somebody turns around and says, "You've given me my life back," that's very rewarding to him. I also like the fact that it was a very small hospital, that there wasn't layers and layers of red tape, and I felt that this small, soothing kind of a country farm-like setting would be very healing for me as I was recovering, rather than being in a big city hospital with tons of red tape and people, and you felt like you were just a number. So that was absolutely true. Everything I thought about the whole operation was, you felt very important. The aftercare was tremendous. I was there for 9 days, and I felt like the nurses were always monitoring me, making sure nothing would happen, and that's probably why they don't have any infections over here. I felt that I was a very complicated case. On a scale of 1 to 10, I heard I was a 10. I went into the surgery. I had scoliosis at L2-3. I had rotation of the spine. My right side was rotating forward. I had spondylolisthesis. I had a ½ inch. The L4 and L5 differential was about a ½ inch, and then it would slide even more when I did flexion or inflexion. And so going into surgery, we were planning on 2 fusions and a motion coupler above that. So it'd be a motion coupler at L2-3, a fusion at L3-4, and a fusion at L4-5. And as Dr. Bertagnoli explains, for every lumbar, for every fusion you put in, you're taking that percentage of motion out of your lumbar. So you have 5 lumbar, and if you put in 2 fusions, you've just taken 2/3 of the motion out of your back. And one of my compelling reasons also for coming was that his desire to keep the motion in your back and the flexibility. In everything he says, that's his goal. And that I didn't feel was offered to me in the United States. And I think that his expertise, his experience over 5,000 surgeries, his being on the cutting edge, and always continually learning gives him in this advantage that for this type of surgery, what I had done, I couldn't get in the United States. So what happened in the surgery, he was able to actually go in and do only one fusion at L4-5 and do 2 motion couplers at L2-3 and 3-4, which gives me a tremendous amount of flexibility that I can maintain, and that is going to affect the rest of my life. I felt that when I met him, I was a little apprehensive. I hadn't met the doctor until the day before surgery, but once you meet him, all your fears are assuaged. You just feel he has 100% confidence in what he does, and I basically said, go in and do whatever you think needs to be done. To call an audible at the line. And I feel in hindsight I've done the right move. I think that the first week's a little rough. I had a 360 surgery, which is from the front and the back. So it's very invasive. The first week's a little rough, but you get better every day exponentially. And I'm already walking more now than I was able to walk without pain before the surgery. And I don't feel like I'm going to have any follow-up care. I think you just send in x-rays afterwards. And I look forward to a life of an active life, a pain-free life, and we eternally grateful for all the people that have helped me get here, and the fact that I was able to come over and have surgery by Dr. Bertagnoli, and I really recommend it to anybody who's values the rest of their life and being able to move pain-free. Guten Tag, as they would say in Germany.